As you become more involved in your mom's health care, you know she relies on traditional Medicare, but you aren't entirely sure of what it covers. Suddenly, you get the call. Your mom fell in the bathroom, hit her head, and she's on the way to the emergency room. As you race to meet her, it is vital to understand how Medicare coverage works so you can manage the transition between payment sources effectively. Do not assume Medicare will simply cover it. Hospital coverage, observation versus admission. Medicare Part A is the primary coverage for emergency room treatment, hospitalization, and inpatient rehabilitative care. However, the extent of coverage depends on the patient's status. Some patients are held for observation. This means the need for inpatient skilled care is not clear. The cost of observation is not covered by Medicare A. While Medicare Part B may cover some physician costs, the facility costs are often the patient's responsibility. This classification can be appealed for redetermination. Admitted for treatment. If the patient requires inpatient skilled care, they are officially admitted. Medicare Part A covers this after the annual deductible is met. The patient pay amount is as follows. For days 1 through 60, the patient pays nothing. For days 61 through 90, the patient pays $434 a day. For days 91 through 150, the patient pays $868 per day. After day 150, the patient is responsible for 100% of the care. If a patient is treated and released from the ER within 24 hours without being admitted, costs generally fall under Medicare Part B. Inpatient rehabilitation. If a patient is discharged from the hospital to a rehab facility before going home, Medicare Part A covers the cost only if the patient was admitted for treatment and spent at least 3 midnights in the hospital prior to discharge, and the care is medically necessary and prescribed by the physician. The patient pay amount is as follows. For days 1 through 20, the patient pays nothing. For days 21 through 100, the patient pays $217 a day. Beginning on day 101, the patient is 100% responsible for the cost. Now, caution. Rehab facilities often claim Medicare Part A coverage must end because a patient is, quote, no longer improving. This is a common misconception. Per the legal case Gemma versus Sebelius, the legal standard for coverage is whether skilled care is required to maintain or improve the patient's current condition or prevent further decline. You have a right to appeal if coverage is terminated prematurely. Discharge to home health care. Some patients require a reduced level of skilled care, which is physical therapy, occupational therapy, maybe nursing care, on an interim basis and are discharged home to receive those services. Medicare coverage for home health care is temporary. The payment source for home health care depends on where the patient was discharged from. If the patient is discharged from inpatient rehab, Medicare Part A typically pays. If the patient is discharged from the hospital directly, Medicare Part B typically pays. Medicare may also cover the cost of an aid for unskilled services, such as bathing, only while the patient is receiving skilled services, such as physical therapy. Once the need for skilled care ends, Medicare coverage for the aid stops, and the patient must self-pay to continue services. Long-term care and Medicaid. If a patient only requires custodial care upon discharge with activities of daily living, Medicare does not cover it. This is the most expensive transition point. The sources of payment are self-pay. In Delaware, home care ranges from $35 to $55 an hour. Assisted living, $5,000 to $10,000 a month, and nursing home care costs $15,000 a month. Long-term care Medicaid. When the need for custodial care is permanent, qualifying for long-term care Medicaid is an essential component of a sustainable financial plan to pay for care. Medicaid is a benefit for the disabled, not just for the indigent. While there are income and asset limits. Federal law allows individuals to protect a significant portion of their assets to qualify for Medicaid. Once approved, Medicaid pays 100% of the cost of care. To learn more about protecting assets and qualifying benefits, visit our website, DelawareElderLawCenter.com.